That's right, George. That's that's just the way it is. All right. So let's move on to number about 26, I think. What is hemostasis? All right, hemostasis. First of all, hemo, we should know by now, means blood. Stasis, in this case, has to do with the word static or stopping. In other words, we want to stop the flow of blood. Because generally, if you're bleeding, that's not a good thing. We need to put a stop to that. Otherwise, you will be dead. And that can be a bummer. All right. So, what are the steps in this? Number one, first thing. So, you're looking at your blood vessel. You have what we call vascular spasms. In other words, they constrict and they get closer together or get narrower. The fancy word for that is vaso, which vaso means vessel, and constriction just means it constricts or gets narrow. So vasoconstriction, the vascular spasms cause the blood vessels to get narrower. Obviously, less blood is flowing out, and there's a smaller area now that needs to be stopped up, just this little area, so the whole thing here. So as they get smaller, it makes it easier to stop them up. All right. The second part is we'll call the platelet plug. So those platelets we talked about, the little fragments of the megakaryocytes, all right, they start clinging to the lining of the vessel and stuff like this and helping to clot it up and clog it up, okay, and they kind of stick to that, all right. Just for the record, the platelets in this first step release serotonin. Okay, you may have heard of that. That's a lot of times people take that for various reasons. But serotonin is a hormone that causes the vascular spasms. Okay, and then these platelets start sticking to the inside here. Okay, and it's because of another chemicals they release that make them all stick. All right, and then finally, the actual coagulation or the blood clotting occurs, and this is because there are some factors in your blood. We talked about the clotting proteins or fibrinogen that are in your blood dissolved normally. Okay, there's another chemical produced, thrombin. Anytime you see thromb, and we'll see that quite a bit today in this little section we're talking about, thrombin has to do with clots or something like that. So thrombin is a hormone ending, so it's a hormone that causes the fibrinogen that we talked about before that's dissolved, and that's dissolved in the blood to change into fibrin, or little tiny threads that all start making this little network in here, and that helps the platelets and red blood cells and other things start to stick to that, and that actually makes the scab or the clot. Okay, and so thrombin causes the fibrinogen to form into actual threads. And if we look at this in the microscope, it'll just be 1 minute you see blood, and then all of a sudden there's these little threads will just pop up in the screen, almost like time-lapse photography. It's just 1 minute it's there and it's not there, and the next minute it is. Okay, as it changes from fibrogen to fibrin. All right, and that basically is your clot or your scab. If it's on the surface, we call it a scab. All right, now someone says, well, was that good or bad? Are clots bad? We tend to think of the word clot and we think, oh, that's bad. We think of scabs, and well, that's a good thing because it stops the bleeding. It's not so much, they're basically the same thing, one's just inside your body and one's outside, but it's a matter of where it is and what it and where it goes or where it stays or doesn't stay. That's going to be the problem. Okay, so first of all, a thrombus. Let's talk about a thrombus. We already said the word throm tells us this has something to do with a clot, and so basically this is a clot that forms and persists. In other words, it doesn't just go away. Persists in an unopened blood vessel. All right. Obviously, if a blood vessel has been cut open or something, then a clot is a good thing. But if you have an unbroken blood vessel, it's just a clot floating around in the middle of the blood vessel, that can be a bad problem, because blood vessels are going to go from arteries down to smaller arterioles and eventually the capillaries that get smaller and smaller, and eventually that clot could clog up the artery and keep blood from getting to a certain part of your body. Okay, now how much damage that does depends on what part of the body is not getting the blood. Okay, a coronary thrombus, okay, a coronary thrombus or coronary thrombosis, all right, if the thrombus is located in a heart blood vessel, and it clogs up the blood vessel, there's no oxygen going to your heart right there in that particular area, okay, then it's going to cause a heart attack, or at least kill the heart muscle in that area. The more of the heart that is being blocked and not getting oxygen, therefore is dying, the more severe the heart attack. If it's a very small area of the heart, then it may just kill a little patch of cells there, and it may not, if you have really small heart attacks, you may not even know you have one. But the bigger the area that it kills stuff in, then it's going to cause problems, either a heart attack or just killing muscle. All right, now, alright, I may have misspoke myself up here. A thrombus, it's persisting in an unopened blood vessel, but it's just stuck on the side or forming somewhere like that. Okay. Now, when it becomes really dangerous, now if it gets big enough, it can still cause problems. If it's in the heart, like we said, a coronary thrombosis or coronary thrombus, it can block enough of the blood vessel that can cut off the blood flow. Okay. But what can also be a problem is if it breaks loose, and now you have a floating clot, and these are particularly dangerous. For example, a lot of times you have very low circulation in your feet because they're trying to push the blood back uphill, and so the blood's having a hard time coming back, especially as you get older. And so it makes clots. Well, the clots aren't too dangerous down your feet, but if they break loose and become an embolus, then they can be very dangerous, depending where, once again, where they end up getting in the way. Okay, free floating. So this one is broken free of the wall. It's a free floating, whereas this one is attached to the wall still. Okay, it can still be a problem if it blocks the blood vessel, but it becomes even more dangerous once it breaks off and starts going around. All right, floating around through the thing. Now, if it's a cerebral embolus, cerebral is, of course, in your brain, and so basically, if it breaks loose and clogs up a blood vessel in the brain, same thing, it begins to kill tissue, depending how much tissue and how serious it is. But instead of a heart attack, this time you're having a stroke. So a stroke is just when you block a blood vessel in your brain and tissue starts to die. A heart attack is when you block a blood vessel in your heart. And it can be from an embolus or a thrombus, either one. Usually your brain, it's more likely to be an embolus that floats in from somewhere else and causes that problem. All right, so obviously having clots where you don't want them can be a problem. So the next question, what are some factors that can cause these undesirable clots that we really don't want to have? How can we prevent those, or what are some things that cause them to form? Anything that roughens the lining, okay, of the blood vessels. All right. If they are smooth and slick, then, but anything that makes it rough or jagged on here makes it more likely that platelets will stick to it, and then fibrin starts forming, and that hemostasis, the blood clotting thing, starts kicking into gear. Okay, so that's one thing. Severe burns to an area, to tissue. Okay, it can damage the tissue and make it more likely. Physical blows. All right, obviously bruising and stuff like that is basically just a clot that's forming underneath your skin. Okay, fatty materials accumulating on the edges of the cell as you get cholesterol and other things starting to stick to the side. Same thing like this rough area. It's going to make it easier for things to stick on there and then clot and then maybe break loose and go somewhere else and cause problems. Slow or blood pooling. Okay, like we said, like in your legs where they have a hard time flowing back up. Yeah, for most people that's not a problem, but once again, as you get older, that tends to be a big problem for people. All right. Now, there are several diseases that are relating to clotting, or just like too much clotting can be a problem, you can have too little clotting, okay? So let's look at those two right quick. They're similar but different. All right, the first one is thrombocytopenia. Thrombocytopenia. All right, that's a good chance to practice our words. Thrombo, we know, has something to do with a clot. This has to do with cells. And penia, penury, poor, you only got pennies, you're poor, so we don't have enough, okay, of something to cause it. And basically, It's when you do not have enough platelets, low or enough sufficient number of platelets. All right, you don't have enough platelets to actually clot up like you need to. All right, now some of the problems with that then, obviously you have what we call spontaneous bleeding. You just start bleeding for no reason because maybe cells, instead of clotting, just keep bleeding out, and it could be inside your body, for example, and if you don't realize that, then you could actually bleed to death inside your body, or at least enough to cause lots of problems. And you usually get kind of purple blotches and stuff where the blood leaks out into the tissues and stuff like that, and that is called petechia. All right, petechia, and these are the purplish blotches that form because since you can't clot normally, your body a lot of times you don't even know you damage something and it just clots up on its own and does whatever. But when it doesn't do that, then you get this. Now, this one can be cured sometimes with vitamin K supplements because vitamin K is a very important vitamin that is necessary for blood clotting to form normally. Okay, so you can take vitamin K. Vitamin K, for the record, is produced primarily by bacteria in your intestine for you, so that's good. If you don't do that, you can. If that doesn't help, then you can just get a whole blood transfusion, and you have to get the whole blood because you need the platelets. Okay, and so you can't just get the plasma or something like that, the liquid part. You need the platelets. So sometimes they may actually have just the platelets separated out. Okay, sometimes it's just easier just to get them a whole blood transfusion, and you will get the platelets that come with it. Okay, so that is thrombocytopenia. All right, the other one that is a big deal here is hemophilia, and you've probably heard of this one. Sometimes it's called bleeder's disease because basically they keep bleeding. So just one L, hemophilia, and basically blood and it loves to bleed, basically is what it's saying. Okay, first of all, this one though is hereditary. Okay, it's a genetic thing, and basically there are no clotting factors. If you remember, clotting factor is the stuff that's dissolved in the plasma, and it's supposed to be there, and then when it gets triggered, it's supposed to turn into the fibrin and make the clots and all that things. But if you have no clotting factor in your blood, then when the thrombin tries to make the fibrinogen, you have no fibrinogen, so there's nothing to change into fibrin, and you just never clot. And so any kind of minor trauma, little minor cut, whatever, can become dangerous because it just continues to bleed and bleeds and bleeds. It also can cause joint pain and some other problems, but the biggest one obviously is that you just bleed out a lot. Okay, any little cut can become very serious. Now, if you want to cure this, they can get purified clotting factors. Okay, so they can take the blood and get just the clotting factors out of it and put it in, but that's obviously once again more expensive than that. Or they can give you a plasma transfusion or injection. Because most people's plasma has the clotting factor or the fibrinogen dissolved in it, and so if you give them just someone else's plasma, it should have the fibrinogen, which will allow them to clot up their blood. But obviously this would be an ongoing thing over and over, and usually people that have hemophilia eventually will die of complications of it and don't live as long. It's particularly higher for some reason, no one knows really why, but in African American or black people, and there's really not a good reason for that, we don't know, but it is higher in those. All right, and that's it except for the clinic questions, and we'll do those in our last video.